All right, good morning, Dr. Jaffe. We have a customer writing in asking about repair guard interaction with blood thinning drugs. Would you recommend avoiding concomitant use or paying closer attention to INR once starting high dose repair guard? And we're talking in the neighborhood of 8 to 12 a day for chronic pain.
Well, we'll talk about the benefits and safety and efficacy of the quercetin dihydrate and the soluble OPC that we have long used and recommended. But before we get to that, we have to look at the other side of the question. When you say INR, that means to me as a clinician that you're taking a blood thinner prescribed by a doctor, probably warfarin or Coumadin, whose monitoring depends upon a test called an INR. And it's a measure of, is your blood too thin? Is it clotting properly? Is it too thick? So if you're already on Coumadin or warfarin, or if you're on one of the blood thinners that are prescribed that do not require INR and monitoring, you still need healthy endothelial cells. You still need the body to repair itself. You still need healthy flavonoids and flavanols called polyphenolics. And of all the thousands, and we have review articles available that Jayashri Mani and I have published on flavonoids, flavanols, polyphenolics, the variety of quercetins, the variety of orthoproanthocyanidins, the OPCs. And the bottom line is the safer, more effective, more soluble, more beneficial is the quercetin dihydrate and the soluble OPC. And I was a coagulationist before I became an immunologist and an advocate for proactive prevention. So I'm very familiar with this issue. In fact, if folks know that collagen is activates platelets, if folks are aware that collagen and platelets activate each other actually, but that collagen activates platelets, that was work that Dan Dakin and I published in the early 1970s. The aspirin tolerance test was something I helped standardize and benefit from. So I am familiar with the issue. I want you to know that there is no negative nor positive interaction per se. However, aside from effects on blood clotting, the real complications happen at the cell surface endothelial level. And of all the things that favors endothelial health and well-being, quercetin dihydrate and soluble OPC in sufficient amounts is absolutely indicated and not contraindicated. And let me finish with an anecdote. If you are an orangutan in Balikpapan, Indonesia, and you needed repair for whatever reason, let's say you fell out of the tree, you'd go up to the top of the canopy, you would take little green shoots and you would eat lots of them, and you would get 10 to 20 grams a day of quercetin dihydrate and grams a day of soluble OPC, and you would heal from your wound, your trauma. So yes, we know the safer forms of polyphenolic flavonoids and flavanols. Yes, the other forms in high dose can be irritating and problematic, but it is now 35 years that we have been using and monitoring the use by our colleagues of quercetin dihydrate and soluble OPC in PERQUE Pain Guard, in PERQUE Repair Guard. And by the way, Repair Guard has twice as much of each, plus the benefit of freeze-dried pomegranate juice, that's ellagic acid, that further helps the first-line repair and first-line immune defense cells to defend you. So the answer is use PERQUE Pain Guard and or PERQUE Repair Guard along with PERQUE potency based on C-cleanse or however you determine the antioxidant needs. There's a strong synergy between ascorbate and safer polyphenolics. And be guided by your physician whether there is a need, continuing need, for prescription anticoagulants. So no contraindication between what I'm saying. Follow your doctor's guidance on the prescriptions, follow our guidance on the physiology before pharmacology or along with pharmacology.